I'm a resident from Sarakshi Netralaya, Nagpur. I'll be presenting you my paper with changes in the ocular milieu after vitreoretinal surgeries. So basically the aim of this study was to assess the changes in the ocular milieu after vitreoretinal surgery with various type of endotamponades. These ocular parameters were endothelial cell density, central corneal thickness and the intraocular pressure, preoperatively and the postoperatively at 1 week, 1 month and 3 months. So study was conducted at Sarakshi Netralaya, Nagpur for the period of 16 months on the 130 patients, and it was approved by the ethics committee. Inclusion criteria for this study was a patient undergoing pars plana vitrectomy for a retinal detachment, macular hole, epiretinal membrane, vitreomacular traction, proliferative diabetic retinopathy and the other retinopathies, excluding the patients with the pre-existing corneal dystrophy, degeneration, history of glaucoma, trauma or uveitis, non-retinal dystrophies or degeneration. With also we excluded the previous history of any intraocular surgeries other than the cataract surgery and the patients with less than 15 years of age. So we divided our patients into 3 groups, group 1, 2, 3 and 4. Group 1 having phakic patients with the silicone oil, group 2 pseudophakic patients with the silicone oil, group 3 phakic patients with gas or air as an endotamponade, and group 4 pseudophakic patients with gas or air. So results, considering the endothelial cell density, the changes from preoperative to postoperative condition are shown in this table, which are well represented in this line diagram. As if you can see, with all the groups, the endothelial cell density is gradually reducing over the period of time, comparing with the preoperative condition and the postoperative condition. In all the groups at all the stages, the changes were statistically significant. Now, central corneal thickness. The central corneal thickness changes wasn't that significant as if you can see in this line diagram, the pseudophakic with oil, the changes, the central corneal thickness was gradually increasing in both the groups, pseudophakic with oil and the pseudophakic with gas, and a phakic with oil patient, the central corneal thickness was gradually reducing over the period of time. Considering the IOP we measured after adjusting with the central corneal thickness, and we did it with the Goldman applanation tonometer. The IOP showed initial rise in the early preoperative period, which then we intervened with the anti-glaucoma medications, which later on controlled the IOP of the respective groups. The change in the IOP was clinically significant, statistically significant in the early preoperative period of 1 week and 1 month in phakic with oil group and the pseudophakic with oil group. With this, my conclusion is, with various endotamponades, pars plana vitrectomy leads to the significant change in the ocular milieu in terms of the entire segment parameters like endothelial cell density and the intraocular pressure. The decrease in the endothelial cell density was comparatively less in the phakic groups as compared with the pseudophakic groups. This implies that the natural lens has the protective effect over the corneal endothelium. IOP rise was noted more in the cases where silicone oil was used as an endotamponade, whereas very less cases had IOP rise in a gas or the air group. IOP rise was controlled by the use of anti-glaucoma medication, and none of them required surgical intervention. Central corneal thickness changes in early postoperative period at 1 week might be due to the corneal edema in some patients, which gradually reverted to normal in 1 month with routine postoperative medicines. Changes in CCT was insignificant at 1 and 3 months in all groups. Thank you.